Muscle Delta Therapy Robot, the next evolution in muscular therapy, assists the therapist to target and lengthen the correct muscles. Muscle Delta Therapy Robot is safe and effective for every type of patient, from elite athlete to pediatric and geriatric, pelvic, pain, and more. Great for therapists. The Muscle Delta Therapy Robot saves your body from repetitive tasks. Great for business and patient. Improved patient outcomes. More patients and referrals. Staff optimization. This suspension bridge is a lot like your body. It's simple engineering. It uses cables, the same way muscles in your body provide you with strength and proper alignment. When all the cables are the correct length, the bridge is properly aligned. Shorten just one cable, and the other cables lose their power to hold as they slacken. The bridge starts to experience misalignment. The opposing cables represent the average person with tension and pain in the back and shoulders. But it is the front muscles that pull them forward that need lengthening and therapy. Simply lengthen the one shortened cable, and the great stress on the opposing cables is immediately eliminated. The body is a series of cables and joints. The muscles are the cables, and they connect all the joints, and they keep the joints properly aligned. When the muscles shorten, they compress nerves, arteries, and joints, and cause great misalignments. Non-invasive muscle lengthening solves many musculoskeletal issues. The Muscle Delta Therapy Robot, being a Class 1 medical device, is inherently low risk, and it elegantly treats muscle slowly and precisely, but very deeply when necessary. Not only is the Muscle Delta Robot more effective at treating shortened muscles than any modality, including human hands, but it is also very safe and should be offered as the first step in treating muscular pain, body alignment issues, lack of strength. This is an Olympic trials high jump athlete getting her peroneus longus lengthened to remove a nagging ankle injury. The peroneus longus is a narrow muscle running the length of the lower leg. The shortening of the muscle from years of repetitive training caused continuous rubbing on the ankle, which is where the pain was produced. Proactively lengthening muscles results in fewer overall injuries, and that number can be significant in athletes. Results are immediate. She reported a 60% improvement after the first 20 minutes and 100% in less than 6 treatments. Simple to use, no complex protocol that we cannot stretch, traction, or solely exercise our way out of shortened muscles. We have treated over 1,000 elite athletes who would have exercised out of their pain or injury. If exercise alone was effective, they would have done it. There are many groups that cannot or will not exercise out of shortened and unhealthy muscles, and those groups include geriatric, injured, in pain, and others. They can, however, be safely relieved of many of their ailments with safe, non-invasive, medication-free of Muscle Delta Robot muscle lengthening therapy. Some patients are ticklish or in pain, and touching them can be very uncomfortable, but the machine can be easily tolerated by all patients who struggle with manual therapy once a comfortable pressure has been set. Once the therapist sets the pressure to the comfortable level for the patient, the Muscle Delta Robot applies exactly that pressure, creating a pain-free and comfortable treatment while still achieving deep muscle penetration. The same for ticklish or patient sensitive to touch. Once the muscle delta robot is set, it is comfortable for the patient. Muscle delta non-invasive robot therapy should be the first step in combating side effects from nerve and blood flow disruptions. Muscle delta therapy robot can treat all soft tissue and is effective in the following areas. The Muscle Delta robot includes a powerful reference database that groups muscles to a specific range of motion. In addition to muscle groups related to the range of motion for specific joints, the database also provides muscle groups for the following ailments. When we select elbow flexion, we are presented with a list of all the muscles related to that motion. When we select migraine group, or chewing group, or even golfer's group, it lists all the muscles related to that action or ailment so we can evaluate and treat correctly. We cannot overlook, and often do, all of the potential problem-causing muscles. Muscle Delta robot is non-invasive and safe. Here are some examples of normally difficult to treat areas, but they are easy with Muscle Delta therapy robot. Supraspinatus. Treat between the acromion process, easily getting deep into this very tricky muscle. Subscapula. Muscle directly under the large flat bone, accessed from the patient's side, allowing precise and deep access to the full muscle. Diaphragm. Behind ribs, a sensitive area requiring precision. This muscle can get very tight and is never addressed by traditional therapies. Huge benefits to the cardiovascular, respiratory, and digestive systems can be achieved by allowing the diaphragm to be flexible again. Piriformis. A very deep muscle under a large muscle, treated easily with power and precision. Muscle Delta robot can target and treat any deep muscle, and other tough ones in this area are gemellus and others. Gluteus muscles. Not just deep muscles, but Muscle Delta robot can treat large superficial muscles using the quick change modular treatment head to match any muscle size or shape, and effectively treat a large area, but with precision. Psoas. A very deep, sensitive area that requires precision. Muscle Delta robot safely and precisely applies consistent pressure to the exact places on the muscle. Again, quickly modifying the treatment head to the proper size of this patient's psoas. The evaluation therapist must not only make sure we are treating the correct muscles by making sure all the related muscles are considered for treatment. A therapist assesses structural alignment and range of motion to identify muscle imbalances. That is accomplished with range of motion evaluation, deep palpation, identifying shortened muscles and unhealthy muscular conditions, and creating a treatment plan for treating therapists to reference. The treating therapist also must be skilled with their hands. Muscle Delta robot controller. Quick reference database assists the treating therapist with how to palpate the muscle with location and other key information, and then skillfully use their hands to palpate and place the treatment head of the robot. The robot then performs the difficult and repetitive work. Even light pressure is difficult to maintain at a constant level and requires great energy from the therapist. Nothing is going to be as consistent and repetitive as the Muscle Delta robot, but it still takes a wonderfully skilled therapist to properly place the treatment head and set appropriate pressure. So the therapist gets to use their brain, hands, and trained skills, but does not have to perform the difficult labor.
Hello, my name is Sean, and I'm a therapist who studied at UNLV. I've been in the industry for well over a decade. This technology not only makes my life easier, but saves my hands and my body. And it gives my patients amazing outcomes that I can't reproduce even on my best days. I no longer want to be in the clinic without my Muscle Delta assistant. I haven't seen anything that delivers the same positive change in my patients' lives.
Muscle Delta Musculoskeletal Therapy Robot assists the therapist to target, lengthen, and restore. Muscle Delta therapy for longer and pliable muscles.